Hello friends, my name is Ankit. I make educational videos on US healthcare. I'm back with another video. If you are new to my channel, welcome. Please like and subscribe to my channel for future updates. In today's video, we'll talk about patient match and how it impacts the FHIR-based interoperability processes. What is patient match? Patient matching is defined as identification and linking of one patient's data within and across health systems in order to obtain a comprehensive view of that patient's healthcare record. In a general term, we can talk about a scenario where a patient has medical, dental, vision, and pharmacy coverage. The different source systems which are housing the respective data, they may be maintaining a different patient ID. We need to perform a patient match to identify that patient so that the patient benefits are accordingly applied. At a minimum, patient match is accomplished by linking multiple demographic data fields such as name, birth date, phone number, and address. Patient match is a critical component to interoperability and the nation's health information technology infrastructure. Why do we need patient match? One of the most significant issues facing healthcare provider organizations today regarding the accuracy of patient records. Healthcare facilities often fail to link record for the same patient. Such challenges can be costly to providers and patients. Add to that emergence of testing and vaccination centers during the pandemic. These centers were anywhere and everywhere. How does patient matching records function in this makeshift environment? So address challenges around patient matching duplication. So electronic health records, also known as EHRs, they are not only as helpful as their ability to talk to each other. The fact is that healthcare facilities, they fail to link records for the same patient as often as half of the time. A recent study also found that as much as 50% of the COVID-19 lab report prepared early on in the pandemic were missing address or zip code, preventing many patients and their physicians from receiving their test results. Identity resolution or patient matching solutions can, without doubt, help improve the patient matching rates. However, many such solutions are based solely on algorithms and probability, and research shows that relying only on these matching methods achieve accuracy rate of only 65%. I can talk about a example based on my personal experience. We do work with various commercial and state Medicaid agencies for helping them on their interoperability journey. In the Medicaid world, we always need the patient match. When a member tries to access their data using a third-party app, they need to be verified by the system that they are a genuine health insurance plan or state Medicaid agency member. So the identity management system used by that health plan, whether it is IDMe, Okta, Ping, Oracle, or any other similar solution, they need to maintain the patient demographic information so that the patient match is performed when the patient tries to access their data. Otherwise, we need to have access to a source system which provides the access to the patient demographic data when a call is made based on the patient access to verify the patient identity. So as we can see in a lot of these scenarios, these are homegrown solution where the match is based on the actual member information and not just based on the algorithm which is performing probabilistic match. But that does not discount the fact that these algorithms are a powerful tool. When we are talking about millions of members being matched, it is very critical to perform the match based on all of these defined parameters and identify and help the patient to access their medical record as well as to get the proper healthcare coverage. Fortunately, new technologies based on referential databases of records on virtually every US citizen is becoming available with automated patient matching accuracy rates as high as 98%. The level of patient matching performance coupled with modern cloud-based services to ease the interoperability challenges has the potential to drastically improve the country's ability to track COVID-19 testing, vaccination, and overall patient match while healthcare services are availed, as well as increase patient match accuracy and reduce duplicate healthcare record across the healthcare facility. How does the lack of patient match lead to high healthcare costs? The poor patient matching capabilities are costly. according to one survey, patient matching issues cost an average of $1,950 per patient per inpatient stay and more than $800 per emergency department visit. The survey also found an estimated 33% of all denied claims resulted from inaccurate patient identification or incorrect patient information. Claims denied for these reasons cost the average hospital 1.5 million in 2017 and the US healthcare system more than $6 billion annually. There is even a report that care of a 11-month-old twin was documented in her sister's health record, costing the healthcare system 43 grand in reimbursement payments. Clearly, the ability to accurately match patients with their data is critical for every provider and payer's business success, especially considering the fee-for-service payment model that have steadily declined as value-based payment models they rise in popularity. How do we perform patient match? We use master patient index. What exactly is master patient index? A master patient index is a service used to manage patient identification in a context where multiple patient databases exist. Healthcare applications and middlewares use the MPI to match patients between the databases and to store new patient details as they are encountered. MPIs are highly specialized applications, often tailored extensively to the institution's particular mix of patients. MPIs can also be run on a regional and national basis. To ask an MPI to perform a match, client uses the match operation which accepts a patient resource which may be only partially complete. The data provided is interpreted as an MPI input and processed by an algorithm of some kind that uses the data to determine the most appropriate matches in the patient set. Note that different MPI matching algorithms have different required inputs. We consult with a vendor implementing the match operation and suggest them to work with a client to identify which algorithm will work best for their particular business need. The generic match operation does not specify any particular algorithm nor a minimum set of information that must be provided when asking for an MPI match operation to be performed. But many implementations will have a set of minimum information which may be declared in their definition of the match operation by specifying a profile on the resource parameter, including which properties are required in the search. The patient resource submitted to the operation does not have to be complete, nor does it need to pass validation. But it does need to have a valid instance. It is used as a reference data to match against. Implementers of the match algorithm should consider the relevance of returning inactive patients, particularly ones associated with patient merges. Now we'll talk about an example. If an inactive patient is matched and its merged target resource will be included, then the inactive one may be excluded. However, if a patient was just marked as inactive for other reason, it could be included in the results. This is one of the example where the patient match operation is required. We are talking about a male named Jim, date of birth 1974 12/25. We have a medical record number and then we have some period defined. If you look at the data, there are different alternate names for that patient. There is different contact information, next of kin information, etc. Since there are different names and addresses defined, there is a need to perform a patient match to associate all of these records if they match to a particular single identifier, so that any medical record or any medical history in future can be associated to that one single ID. Now, if we talk about FHIR resources for the patient operation, there are different type of FHIR resources. The three main resources are match, which finds patient matches using MPI based logic, everything, which fetches the patient record, and merge operation, which merges the patient record. In addition to these, there are operations that apply to all resource types. We have validate, which validates a resource, meta, which accesses a list of profiles, tags, and security labels. Meta add, it adds the profile, tags, and security labels to a resource. Meta delete, it deletes the profiles, tags, and security labels to a resource. Convert, it converts from one form to another. GraphQL executes a GraphQL statement. Graph returns a graph of resources. Add to an array in a large resource. remove from an array in a large resource. Filter an array in a large resource. Now there are different parameters that are used in patient match. So one of them is active. If you are looking for the patient record which is active, then the expression will be patient.active. Now, one more search parameter that we have taken as an example is address. We can derive the address from multiple resources. It could be from patient, person, practitioner, or related person. The expression in each of these scenarios will be patient.address, person.address, practitioner.address, and related person.address. So as we have discussed, it is very critical in the US healthcare system to perform a patient match. The patient may be having different member IDs or other contact information associated in different healthcare system. In order to create a longitudinal health record and to have the ability for the patient or providers to access the entire end-to-end record, it is critical to perform the patient match. ONC is committed on this journey. They, along with HL7, are working on defining the standards around patient match and how FHIR can impact the patient match process. I'm happy to answer any questions that you may have. Please feel free to reach out through my YouTube channel. I'll talk to you all in my next video. Until then, have a good day.